The University of North Carolina at Chapel Hill organized an Institute for Global Health and Infectious Diseases about 5 years ago. We have three missions: teaching, research, and service. Among the most important goals for UNC in the 21st century is its globalization. Within the kind of idea of globalization, working towards a commitment to global health is critical. Malawi is the flagship site of the university for working on all three missions and to allow UNC students to participate in this kind of work.
This summer project is one of the cornerstones of UNC's mission in Malawi, that is providing care and service to the Malawi community. The well was drilled here several years ago to provide clean water and safe water to the children who are going to school here and to the community that surrounds the school. The communities, they are volunteering themselves in preparing the porridge, that the school feeding program. They are the ones that prepare the food for the children to eat. We have the school teachers who are the volunteers from the community, and the school is run by the community. So UNC's mission and this project is mainly to help the communities help themselves.
The situation in Malawi is still dire. Despite a lot of healthcare workers who have been trained, we still have got a shortage with the highest ratio of doctor to patient. But with the help which stakeholders like UNC are doing, at least we are managing to get further training for some of the doctors like myself.
The UNC Project in Malawi is a center of excellence that's associated with the University of North Carolina, and it focuses on infectious disease research, training, and clinical care. The partnership that UNC Project has with the Ministry of Health in Malawi has been a long and growing partnership over a 20-year relationship.
We have been in here for a number of years, since the mid-80s, when UNC was asked by Family Health International to help in implementing some objectives in the country. Well, since I came in here about 2000, at that time, I would say the HIV prevalence in Malawi, or the central region of Malawi, was around 30%. Today, it stands at about 12% in pregnant women, and we think most of that has been due to the expert and perfect and what I call good work being done by our staff in the clinics.
The research that we have done in Malawi is usually based in clinical settings, and that has continued but is expanded into a community-based relationship. For instance, our malaria vaccine project is completely community-based, and we work more closely with even more local partners in smaller health centers and in more rural areas.
Malaria remains the leading killer and also cause of disease in Malawi. We are collaborating with people from UNC and Chapel Hill for the collection of this located information, because this information will also be important for us to know the environment in which our study participants live in, to also know if there was also a lot of malaria existing in these areas with this information that we collect.
We have grown bit by bit over the years, have been successful in writing grants, and now we find ourselves with a big center of excellence. Because we've grown from the bottom up, that's really why we've been successful.
We want to both train Malawians in order to build capacity that they can run these research studies and be leaders in Malawi, but we also want to expose future investigators from the U.S. in these research activities. We're building the next generation of Malawian investigators and researchers.
For the people of Malawi, everything we do is designed to serve their interests. We do service work that includes medical care and clean water and better nutrition. We do medical care, including surgery and obstetrical care. For the University of North Carolina, this allows us to go from a state university to a global university. The students and the faculty are able to see the world totally differently because of the work we're doing in Malawi. And lastly, research on a world stage is essential. They have the opportunities to make discoveries that would otherwise be impossible.